Moya is a progressive disease of the vessels that supply blood to the brain. Moya in Japanese means puff of smoke because of its appearance on a radiograph. This video will show the progression of how vessels can narrow over time. In this picture of normal vessels, you can see the vessels come in and split, going to the side, middle, and back of the brain. The area where they split is where moya changes occur. Stage 1. The end of the vessels just before the split begins to severely narrow. Some of the small vessels in the branching arteries begin to get big. Stage 2. There is a swelling of the vessels before and after the narrowing as they try to compensate for decreased blood flow. Stage 3. Shows continued progression when there is not enough blood supply to the brain coming from the vessels in the neck. There are numerous tiny vessels that spontaneously grow to the side, the back, and the middle. The vessels are called moya vessels. Stage 4. The newly swollen vessels begin to diminish in size and die. Stage 5. The moya vessels become nearly absent, and the vessels coming from the neck are extremely small and allow minimal blood flow to the brain. Stage 6. Complete occlusion of the vessels. At all stages, there is a risk of stroke to the brain, both ischemic stroke due to lack of blood flow and hemorrhagic stroke due to a rush of blood flow from other vessels. Moya tends to present in the very young from infancy to teenagers, and also in mid-adulthood. Most often it's found on MRI scan, showing ischemic stroke and abnormal vessels. The best way to diagnose moya is with the diagnostic cerebral angiogram. Commonly, patients are treated with aspirin and go on to surgical revascularization to resupply blood to the brain.